Hi, my name is Ariana Tompkins, and I'm going to talk about the history of tuberculosis worldwide. Let's start off by saying tuberculosis is an infection caused by Mycobacterium tuberculosis bacteria. Tuberculosis is the #1 deadliest bacteria and leading infectious case of death in the world. Tuberculosis disease is ongoing, with multi-drug resistant TB becoming more prevalent. And TB has been believed to be the first originated from the domestication of cattle. Let's start out with the history. Approximately 30 years ago, the World Health Organization declared TB a global health pandemic. The WHO estimated that 1.8 billion people globally are infected with Mycobacterium tuberculosis, with 1.6 million deaths in 2021 alone. 1953 was the highest rate of TB cases, with 84,304 United States cases alone. Then a downward trend of 7,882 United States cases in 2021. Despite TB being curable and treatable, it is still the world's top infectious killer. So when it comes to treatment, it is super important that we are learning about the prevention so that we can stop the multi-drug resistant TB from growing. Around the world, geographically, most TB cases in 2021 alone were in the regions of Southeast Asia, being 45%, Africa, 23%, the Western Pacific, 18%, and with smaller shares in the Eastern Mediterranean at 8.1%, and the Americas, 2.9%, and Europe landing at 2.2%. In 2021 alone, 82% of global TB deaths occurred in African and Southeast Asia regions, and India alone accounted for 36% of those deaths. Some current statistics on TB, 2 billion people, which is 1/4 of the world's population, are infected with the TB bacteria, with more than 10 million becoming ill with active TB disease each year. This is just a map showing the per 100,000 cases of TB per year across the globe. The mortality statistics globally, 2021 alone, 54% of the people who died from TB were men, 32% were women, and 14% were children under 15 years of age. 11% of the children deaths resulted from poor access to diagnosis and treatment. And without proper treatment, 50% of the people with TB on average will die. HIV-associated TB. HIV weakens the immune system, and with a weakened immune system, latent TB infections can quickly progress to active TB disease, and people living with HIV are up to 20% more likely to fall ill with TB. In 2021, about 187,000 people died of HIV-associated TB, and that's 70% of TB patients who had a positive HIV test result. And then the TB is the leading cause of death among people living with HIV. The life cycle of TB, tuberculosis has an extremely slow growth rate with a generation time between 15 to 20 hours. Every initial bacillus emerges 2 new ones, and then those 2 each produce 2 new, resulting in a rapid expansion. If you want to go ahead and scan this QR code, it will open a quick little video of the binary fission growth of the Mycobacterium tuberculosis. TB depends on iron within the body for normal growth, as well as cholesterol and fatty acids as a primary energy supply. TB bacteria are adaptable organisms, and they can grow on a variety of components within the body. So where in the body would you find tuberculosis? Mycobacterium tuberculosis mainly affects the lungs, but occasionally will be found in the voice box, which is the larynx, brain, kidneys, and even the spine. The bacteria reproduce in the small air sacs of the lungs called the alveoli. A few of the bacilli will enter the bloodstream and travel throughout the body, infecting other organs. That's how it gets to the kidneys and the brain. So how's it spread? TB is spread primarily in droplets transmitted through the air from person to person via coughing, sneezing, talking. So once in the body, TB can be inactive or active. And when the TB bacterium is inactive, it is considered latent TB infection. And when the TB bacterium is active, this is called TB disease. So there's technically 3 different stages of tuberculosis while in the human body. Primary infection, it's going to be your immune system finds and captures the TB germs, completely destroys them germs unless some survive, and then they have the potential of multiplying. Latent infection is the immune system builds walls around lung tissue with the TB germs in to keep them under control and not causing harm to other organs. Active TB, which is the TB disease, is the immune system can't control the infection and can happen months or years after latent TB infection. The disease process. People with latent TB have bacteria in their body but show no symptoms as the bacteria is not active, meaning people may be carriers of the bacteria without feeling ill. A person with latent TB cannot spread the bacteria to other people, and symptoms with latent TB are going to include feelings of sickness, weakness, unexplained weight loss, fatigue, fever. People with active TB, they have the active bacteria multiplying and destroying tissue within their body. This is usually going to show some symptoms of within the lungs, which is going to be coughing, chest pain, coughing up some bloody sputum. Globally, 30% of people develop latent TB after exposure from someone else. According to the CDC, that's an estimated 13 million people in the United States living with inactive TB. And without treatment, 1 in 10, which is 5 to 10% of those may become sick with active TB disease, potentially spreading this disease to others. Multi-drug resistant TB is resistant to niazide and rifampicin, the 2 first-line drugs in treating TB, primarily caused by incomplete medication regimen, which is the primary reason for these growing cases. So how do we stop the spread? There is currently a vaccination available for prevention in other countries, but it is not recommended in the United States. It's the Bacillus-Calmette-Guerin vaccination. Aside from that, washing hands thoroughly with soap and water for at least 20 seconds. We all know how to do that due to COVID. Cover your cough and sneeze with tissues and dispose of them properly. Again, wash your hands immediately with soap and water. Stay away and avoid close contact with anyone with TB symptoms. People with active TB should stay isolated, and people with active or latent TB should complete medication regimen as instructed to prevent the growth. Good news! The good news is that latent TB infection and TB disease are treatable. Latent TB usually consists of a daily dose of antibiotic, the isoniazid, for 6 to 9 months. Treatment for active TB is the isoniazid in combination with other drugs like the rifampicin, and those are taken daily for a period of up to 12 months. Well, I want to thank you for watching, and I hope you were able to learn some valuable information. And if you're able to take anything away from our presentation, have it be this. We can do our part by washing our hands, covering our mouth when we sneeze or cough. With the vaccination not available in the United States, stay proactive on the tuberculin skin test that is required by most healthcare jobs. As someone who personally lives with tuberculosis every day, I think the scientists and extensive research put in to help combat the spread of TB. But it can start with you. Cover your mouth, wash your hands.